In your morning medical news, HHS Secretary Robert F. Kennedy Jr. says vaccination is a personal choice that protects individuals and communities. Those comments come amid a measles outbreak affecting Texas and 8 other states. The CDC reports 164 cases as of last week. Kennedy emphasized that vaccines protect both individuals and those unable to be vaccinated for medical reasons. A new study finds extreme heat can age bodies age faster. Researchers found older adults' exposure to extreme heat may accelerate biological aging, the measure of how well the body functions over time. The study found participants living in extremely hot areas like Phoenix experienced up to 14 months of additional biological aging per year than those who live in cooler climates. Millions of Americans live with knee pain. In fact, researchers estimate about 25% of all adults frequently have pain around the knees, which can limit mobility and impact quality of life. But you can protect that joint. Mandy Gaither has more on how to help and maybe even prevent the progression of knee pain.
It's nothing new. Knee pain is one of the most common complaints. In the U.S., about 790,000 total knee replacements are performed every year. And as people get older, that number is expected to get higher.
Now, most times it is due to osteoarthritis in the joint.
It's a degenerative joint disease causing the breakdown of tissues as a person ages. Osteoarthritis not only leads to pain, but joint stiffness, joint movement limitations, and swelling in and around the joint, especially after activity. But research shows you may be able to slow the progression of the pain or even avoid it altogether by strengthening your leg muscles.
Simply put, people who had more leg muscle mass had a lower risk of knee osteoarthritis. Now, that increased muscle mass can sort of protect the knee, taking some of the strain off the joints.
Experts say strength training is the best way to bulk up the muscles in your legs. The CDC recommends older adults get 150 minutes of moderately intense physical activity each week and at least 2 days of muscle strengthening activity each week. The agency says muscles can be strengthened in many ways, including lifting weights, working with resistance bands, using body weight for resistance during exercise like push-ups, or simply doing some gardening work or yoga.
It's important to start strength training slowly, also maintain a healthy body weight, and just keep moving, keep active.
As part of weekly physical activity, the CDC says it's also important for older adults to work on their balance in order to prevent falls. Recommended activities to help with that include walking backward or standing on one leg. The agency says strengthening back, abdomen, and leg muscles also helps improve balance.